The next panelist is Joanna Stoms. Joanna is currently the Cancer Plan Manager for the Pennsylvania Department of Health, Division of Cancer Prevention and Control. Part of her interest in lung cancer stems from a long previous experience as a registered respiratory therapist. She then earned a master's in public administration and now works for the Pennsylvania Department of Health. Joanna?
Thank you. I'm really honored to be here as well. I was asked to come here to bring the public health perspective to this discussion, and again, I'm very honored to be here. So I work for the Pennsylvania Department of Health in the Division of Cancer Prevention and Control, and we receive funding from the Centers for Disease Control for comprehensive cancer control. So we do have a small, I shouldn't say a small bit of funding, but funding to do comprehensive cancer control throughout Pennsylvania to further initiatives regarding that. And one of the priorities in comprehensive cancer control right now is lung cancer. So we decided to take that on as one of our priorities in our cancer plan. So lung cancer in Pennsylvania has a very broad reach and a very big reach. So it's responsible for over 10,600 cancer cases in Pennsylvania. There's over 7,500 cancer deaths in men and women in Pennsylvania. It's responsible for over 6,900 hospital admissions and over $306 million in hospitalization charges to Medicare. It's second only to colorectal cancer in the number of in the amount of charges to Medicare. And we got that information. We have a really crack epidemiologist in our cancer division that mined our Pennsylvania Healthcare Cost Containment Council data to give us that information. So as you can see, it really does have a very broad reach and a very big reach. If we're using, I'm looking at our cancer surveillance data to kind of target our interventions. That's one of the things we're tasked with, or CDC asks us to do. So if we look at the incidence rates for lung cancer by county in Pennsylvania, you can see the counties in red have the highest incidence rates, and they're really kind of, they're all throughout the state, but there's really a concentration in the southwest and the northwest counties. Those counties are generally less populated, a little bit poorer, except for maybe Allegheny County and Philadelphia County and Delaware County, which do have quite a majority of the population in Pennsylvania. So Allegheny, Delaware, and Philadelphia County would account for the majority of population in Pennsylvania. If you look at the mortality rates for lung cancer by county, again, you can see some of the same counties popping up, which is, again, of concern to us because we have high incidence and high mortality in the same counties. Again, you're seeing Philadelphia, Delaware, those southwest counties, some in the northwest, and Monroe in the northeast. So if we look at the lung cancer mortality rates over time, and we like to do that, we kind of like to look at the cancer rates over time. You can see that they peaked somewhere around 1992, and that's when the federal excise taxes were imposed upon tobacco products. You can see that the lung cancer rates and smoking rates have really dropped over time. But Pennsylvania is higher for lung cancer incidence and mortality rates than the United States in general. So again, it is still a big problem for us in Pennsylvania. So lung cancer screening in Pennsylvania, those initiatives fall in line with our Pennsylvania Cancer Control Plan, which is developed by a large group of stakeholders that is part of our Cancer Coalition. And some of those goals are to decrease the incidence and mortality of lung cancer, to increase awareness of lung cancer screening, treatment, and prevention, and to use cancer surveillance data to target program interventions. We don't have enough money to blanket the whole state, but we do have money to target interventions, and we use our cancer surveillance data to do that. So what did we do? So we partnered with the Division of Tobacco Control and Prevention, which is in our bureau, and the American Lung Association, which really holds the contract for tobacco control and prevention, to provide funding to their regional primary tobacco contractors to do some activities. And two of the four activities that we did is really what I want to talk to you about today. We developed a lung cancer screening toolkit for primary care practitioners. During our work last year, we provided funding for Lung Force Expos, which is lung cancer screening, treatment, and prevention awareness events that we held throughout the state. We held 3 of them. And throughout that, we found that there was really not a lot of awareness going around about lung cancer screening and treatment. So we decided to develop a lung cancer screening toolkit. And I'm sorry I don't have the mock-up on a PowerPoint, but we do have it outside for you on printout, but this is going to be posted on our Live Healthy website. So this was really directed to primary care physicians. So we have some videos, we have resources for patients and caregivers, and we have resources for the healthcare providers. And this is really to educate primary care providers about lung cancer screening. And the video we have here is by Troy Moritz, is one of the thoracic surgeons at Pinnacle Healthcare, which is a community provider of lung cancer screening program. And they are a Lung Cancer Alliance program, and they do a really good job, I think, of explaining that program for primary care providers. And the other program that we did is we integrated a lung cancer screening program into a hospital-based tobacco cessation program. So we kind of did a little bit different than what we've been talking about all along. We took an existing tobacco cessation program and integrated a lung cancer screening program into that. And we just started that because Pennsylvania was one of the few states that had that huge budget impasse, and we weren't able to get our contracts out the door this year until March. So we have from March until now to get all our activities done. So that's been kind of a challenge. So the integration model, we used a community hospital in southeastern Pennsylvania. We used Mercy Suburban in Norristown, Pennsylvania, which serves a lower SES population. It has a higher than average black population. In Pennsylvania, the black population has a higher incidence and mortality of lung cancer. It had a successful tobacco cessation program, and it had a staff willing to submit data for evaluation and to implement the program. So that was also very important to us. So what they were going to do is distribute the ALA high-risk screening tool, but actually what they ended up doing was kind of modifying that for their institution. Participants that qualify for the low-dose LDLC program were to meet with the program facilitator. They are going to arrange for an informed decision-making visit at the facility. So one of the barriers was to find, how do we get them to an informed decision-making visit? And they identified a physician at part of their program is going to be the radiologist that's going to be doing the informed decision-making. And then they're going to refer the participants to lung cancer screening. So the data that they're going to report will be which participants were referred, excuse me, and the total number that completed the LDCT. And they're also going to be reporting their tobacco cessation, data. So our next steps are to promote that lung cancer screening toolkit statewide. We're going to be collecting preliminary data from the integration pilot. We'll be identifying barriers, implementing the solutions, collecting the additional data, and we hope to replicate the program if successful throughout the state. And that's all I have.
Thank you.
Thank you.